The COVID-19 second wave upon us, Mpumalanga Health Department has raised concerns over what it says are fraudulent coronavirus certificates people obtained to cross the Oshoek Border Post. The province's health department says it has discovered that these certificates are issued by unaccredited labs. To better understand the story and how the province is planning to curb this, I'm now joined by Mpumalanga MEC for Health Sasekani Manzini. MEC, thank you so much for your time and for joining us this afternoon. Now, the first time I heard about this phenomena of selling these fake certificates was abroad. How widespread is this problem in South Africa and in Mpumalanga particularly?
Thank you very much, and greetings to the viewers of 45. We are saying that Newzroom, we are saying that as a province, as an MEC, I visited Oshoek, as we are correctly putting it. In terms of our monitoring, in terms of the COVID-19 regulation, we have discovered that there are fake COVID-19 results that are presented, but in the main, so far, are not from the country, are from the nearest countries that we are bordering, of which is a serious concern, but also to allay fears of the people of South Africa is that SAPS is doing a very good job. Hence, they were able to pick up that some of these results are not a fraud. Hence, they were arrested, some of these people. And also, but we have agreed that we need to work with the different countries in terms of making sure that we find out where are they getting these fraudulent results, so that, because it's a danger to the people of South Africa, because these people will be allowed to get into the country. Meanwhile, they were not properly tested in terms of the regulation of the 72-hour COVID-19 test.
MEC, are you saying, as far as you know, that this problem is emanating from our neighboring countries as opposed to South Africans who are trying to leave the country with these fake certificates?
So far, but of course, now that we are moving towards the festive, you will understand that you can't rule it that even in the country it might happen. But hence, we are saying that we are happy so far because we are able to discover that. But what we have said is that we need to go deeper, and also that will have been reported to national to say these are the findings in terms of our visit. But of course, we want to warn our people that if you are found to be having this fake COVID-19 results, you'll be arrested. So our people must refrain from not using the accredited lab that are there in the country in terms of getting the results that are accurate, and refrain from going to those people that are producing, because it can tell you that they were not tested. They are just producing those results to these people.
Now, MEC, I mean, as we are fully now on the second wave of COVID-19 as declared by the Minister of Health, how concerned are you that this trend is happening?
Of course, that's why at the border there is NHLS that are conducting taking swabs in terms of the results of COVID-19. So people, but of course we are encouraging people to all go to the border and want to take the COVID-19 test, because that on its own, it will be spreading COVID-19. Hence, we are encouraging those that are planning to travel to say that they must get their results before 72 hours, wherever they are, so that it make it the smooth operation at the border. But of course, also at Oshoek, we have established another lab at Mbuleni Hospital, which is not far from the border, so that it makes the work of NHLS to be easy in terms of getting the results when they are there. But we want to say to our people, we'll be having many people traveling through our borders. Make sure that you do get your results of COVID-19 before you travel to the borders. But of course, you can imagine that as a province, we are not having many cases so far, and we will want to remain as such. Hence, we want to argue that it will be in all our taxi rank, all our malls, everywhere, also in the border. You know that we are bordering your Gauteng, KZN, and also Limpopo. So far, we are having 527 active cases as a province. So we don't want to increase the number of cases in the province, as we are saying, we'll be screening them in the different borders, and also making sure that the behavioral change of our people That's what will assist us as a province so that our number does not increase and the number of people that are dying of COVID-19 are not increasing in the province, even during these festive seasons. Hence, we are saying to our people, the best Christmas that you can enjoy this coming Christmas is to stay at home with your family and enjoy quality time. By so doing, you'll be assisting us as a province not to increase in terms of COVID-19 cases.
Now, MEC, your job arguably is more difficult during this time. Not only are we in the second phase of the COVID-19, but it's earmarked to be even worse than the first wave. Now, your province accounts for about 1% of the current increases we are currently seeing in the country during the second wave. What exactly are the new measures that you've put in place in hospitals outside of the borders, where you are currently tracking? But in hospitals and inland, as you've said, it's all about behavior change. I'm wondering then, are your efforts intensifying more than what we've seen in the first wave?
I agree with you. In terms of the second wave, it will be more difficult because our people, they think that if they were not infected during the first wave, then they will not be infected now. And also, we are seeing the manner in which our people are behaving. They are no longer putting on their mask. They are no longer even adhering in terms of the gatherings. But of course, we'll be working with COPTA to monitor and enforce the COVID-19 regulation. And also our teams will be all over making sure that our people comply. But in the main, what the Premier of the province did in terms of a ward-based model, and that on its own, it means all different stakeholders, because you cannot win the battle alone as the provincial government, but you must work with all the different stakeholders, of which we are doing well so far, our traditional leaders, our religious leaders, and all the different sectors. We are working together in terms of always telling our people, reminding them that how to make sure that they observe the health protocol. So I believe that if we manage, hence I've said our numbers are still very low and we want to keep it at such. Hence we are saying, even those that will be visiting, we know it's time to visit. We will work with the economic development in terms of, that there are tourist areas in the province. We'll make sure that all of them, they adhere to the regulations. And if we are not adhering to the regulations, of course, we'll be working with SAPS to assist us in that regard in the province.
Now, final question, MEC, before I let you go. We're talking a lot about behavioral change, and it seems very apparent, especially if you look at these fake COVID-19 tests that people are bringing into the country. It tells you that there's also a lot of information that people are not aware of as it comes to COVID-19. I mean, it only means that you have to quarantine or self-isolate for 10 days, and then you can travel. What are we doing as a country, and particularly your province, to deal with this behavioral change, to ensure that people, adhere to those 3 simple rules during this time of social distancing, washing our hands, and also wearing masks?
As I'm saying, we need to partner, of which that's what we've done. The ward-based model is where we look at the level of a ward in terms of all the economic activities that are happening at that level. If whether the shops, the mines are adhering also to the health protocol, and also to indicate to them in terms of the danger of if you are infected. It's not only about yourself, it's about your family, it's about the community where you are living. And what we did further than that, as a Department of Health, we also launched what is called a clinic-based model, where we are making sure that those with comorbidities, of which we'll continue to do even during this time, they get their medication so that they are stable if they are infected, because we have seen that most of the deaths in the province, those with hypertension, diabetes. So hence we are looking at the preventative measures at the level of a clinic. So if we can do that, and also working with our community health care workers, which are doing the door-to-door. When they are doing the door-to-door, they are also screening. It's not only screening, but in terms of educating the community in terms of how to behave in terms of yourself being prevented. But of course, I'm saying we're working together with the municipality, the local command council, the district, and the provincial command council. At that level, that's where we meet with different stakeholders so that together we'll be able to deal with the behavior of our people in the province. At the same time, preparing as a province in terms of our health facilities. We've done that before. We are screening in all our facilities, with the clinics, and also in our hospital. And now we are even testing everyone that is admitted in our hospital, of which we can say that as a province, we are ready in terms of dealing with the second wave of the COVID-19.
Well, MEC, that's where we have to leave it for this afternoon. We'll continue to monitor the story, obviously, at Oshoek Border Post as those numbers continue to rise there and as people travel during this time.